DiPiro, and it's my pleasure to welcome him as a colleague and friend. He is the dean and a professor at Virginia Commonwealth University in Richmond, Virginia. And I would describe him as one of our academic leaders, especially in the world of publishing, as many of you will recognize the name because he is the senior editor of the textbook Pharmacotherapy, which many schools of pharmacy use for their therapeutics courses. And he's also been the editor of the American Journal of Pharmacy Education. And he's been a past president of AACP and also ACCP. So it's my pleasure to welcome Joe. So the way this will run is I'll ask a few questions and Dr. DiPiro will go ahead and respond. We also know Dr. DiPiro as Miss America's Dean. So that's a new title he gained in this last year. So let's see. Okay, let me turn it over to Dr. DiPiro. So what I'd like to do is begin with we want to really learn more about your journey to your current position and recognition as a leader. So why don't you go ahead and share with us a few comments in that regards.
Sure. Good morning, everybody. It's really a pleasure to talk to you today. It's been almost 40 years now that I've been in academia, and I came into academia right out of my residency program. You know, when I started out, I really didn't have any ambition or thought to be a dean, and it just came about after a number of years. You know, I was thinking to how we talk about leadership today within our schools of pharmacy, and it's so much better, so much more discussion about leadership than was ever the case when I was in pharmacy school. In fact, leadership development was never mentioned. There were never any formal programs for developing leadership skills or thinking about leadership. So I think we're in a lot better place now for people to think about leadership incorporated in their careers.
Very good. So were there key events or key people who really influence you in your journey?
Sure. And another thing about the way I went about it, you know, I know people who they set out to be a dean or a director from day one in their career and they worked toward that. And I never really had that aspiration. And so when I started as a faculty member, I really loved what I was doing in the clinical world and teaching and clinical research. And it wasn't until about 12 years later that it really kind of dawned on me. And at that time, the department chair position, I was at the University of Georgia at the time, it came open. And I realized that I was thinking differently about leadership. If you had asked me before that, I would have said, no, never, not going to do that. And that really changed as I gained more confidence and thought, you know, I could do this, and was getting support from other people to do it. So I think an important experience that a lot of people have is that no matter where you start in your career, years into it, you think differently about things, and aspects of your career that weren't important before become important. And so I realized that being a department chair, I could have a lot of influence over how things would happen in the school, positive influence in developing programs and people. So that's really how I got into formal leadership, was as a department chair, and did that for 12 years. And then had my first opportunity to be a dean. This was in South Carolina. And then I've been here as dean now for 6 years. But again, the key thing that I experienced was really a change in mindset about my leadership roles and opportunities.
Mm-hmm. Great. Yeah. That's quite a difference from some people who set out, like you said. Some people set out, they exactly know. And I don't think there's one way for anybody. You know, some people know that's where they want to be, and others, it just evolves. Why don't you share with us, I'm really curious how you developed the concept of a need for a textbook, the pharmacotherapy textbook. How did that come about? I've never heard that story, so I thought I might ask you to share that with us briefly.
Sure. Yeah. It goes back to the early 1980s. And at the time, the actual idea came up in a discussion that I had with someone from one of the publishing companies at that time over lunch. And, publishing companies are always in the process of looking for new ideas and authors. And so the idea came up, what about another textbook that would be a different style from the ones that were out there? And at the time, so again, early 1980s, it seemed very intimidating. How could you do this? It would take too many years and so many hours of effort to put all this together. So the key things with it were that the idea was there, but putting together a team took a couple of years. We were able to put together a team. Took a few more years. And so to me, it was kind of a persistence lesson, staying with it, putting in the effort, a little bit of effort each day, each week, and getting there after a few years. Once it's done, the subsequent editions are a lot easier to do. And so the other thing that really worked out for us is a good bit of luck that we began producing this textbook at about the time that PharmD programs were expanding very rapidly, certainly from the 80s into the 90s to the point where in 2000, all schools were all PharmD. And then the interest around the world in terms of patient-oriented pharmacy education has come about in the last couple of decades as well. So we looked out with the timing, but I think the key things were having a relatively simple idea, putting a team together that could do this, the editor team, and then subsequently a couple of hundred authors to help with all that, and just being persistent with it.
Yeah, it's a significant accomplishment. I know when our students meet you, they all want to get a picture with you. So that's probably quite humbling, to say the least. Well, thank you very much for those insights. So looking back at your, looking forward, I should say, in 20 years from now, what would you believe will be your legacy? What will you be, let's say, and I think we know what your legacy is to some extent, but what are you going to be most proud of in terms of your contributions to the profession that really help advance our profession?
Well, thanks, Terry. The legacy is not really something I can judge, other people judge, but I think about what I'm most proud of, and that is the people that I've had some influence in their careers and see them be successful in their careers. So from students who become practitioners, students who become academicians, our young faculty that go on to successful careers, all that is really the key for me, and again, that I'm most proud of. So to date, there are 4 of my former students who are now deans of schools of pharmacy. And that is just absolutely terrific, that in the things that they're doing and to watch their success. But it's not just in academics. A lot of my former students have gone on to careers in other parts of the practice of pharmacy and pharmacy industry and government service. So that's really the top. It's hard to say now. There's a lot going on that I think is very important work in the school that I'm at Virginia Commonwealth and where I was before, and building programs, building research programs, degree programs, and the like that could down the road prove to be very important. Maybe too early to tell, as time plays out. And certainly the book effort has been important, but it's hard to say what the legacy on that will be in 20 years from now. Our ways of learning and transmission of knowledge have changed so dramatically. And for us with the book, it's gone from the print era, and back when we started, it was only print, there's nothing online, to now most of the usage is online, and who knows what form all this will take in the years ahead, how people get knowledge, access to knowledge. So that may not be a lasting influence as one might hope for.
Great. Do you have any words of advice for students in their professional journey, advice in particular as in terms of really making a contribution to the profession and really becoming a leader in their own environment?
Sure. And I'll bet this is something that you'll be talking about in your course, and your students have heard about the concept of big L leaders and little L leaders, and to always be thinking about, you don't have to have a formal title of a director or a dean or something else, manager, to be a leader. That everybody can and should be leaders, can exhibit leadership behaviors. Think about the things that a lot of our students do that, again, not in formal positions, but behaving like leaders. And so that's really the key and where it starts. I think there are a lot of things that beginning as a student and early in a career that someone can do to learn more about leadership. And that in itself is an important concept. Now, I still consider myself to be a student of leadership, and I'm learning things when I go to meetings, when I see people in university administration and how they're acting and behaving, and I'm learning a lot from that still. I think back to people in my career. So as students, who do you see in your network of people that you can learn leadership skills from? For me, it was some of my professors. It was residency program director at Kentucky, Paul Parker. Then some of the people who are now deans or university administrators that have been very helpful to me as mentors and people that I look to learn about leadership skills. I'm also interested in reading about leadership, and there are a number of good sources out there. I have my favorites, and if you talk to other people, there may be other books and sources of information that they point to as being good instructions for leadership. But the key ones for me that I've just found to be very helpful over the years, and I recommend them whenever I get the chance. And one is Jim Collins' Good to Great. Mm-hmm. And he has a chapter in there on fifth level leadership that is the best thing I've ever read to really describe influential leadership and what one can aspire to be in terms of a leader. Another book that is really leadership skill, because leadership is, a lot of it is, if you had to boil it down to one word, is influence, having ideally a positive influence, and an influence is for the purpose of change. And so another key reference that I think is important for all leaders is Leading Change by John Kotter. It's been around for a long time, but a consistently referred to book, and it gives people at any level of leadership thoughts about how you get things done, how you lead an organization, create change for positive effect. There are some other books. Another one that's, again, been around for a long time, and I always recommend it if people haven't read it yet, is 7 Habits of Highly Effective People by Stephen Covey. There are a few others, but those are some. If you're looking for ways to enhance your leadership skills on your own for the students, this would be, I think, some good places to start. And then looking for opportunities. There are so many workshops. There are programs at the state and national level that you can go to and attend, and I always pick up something, or can you continually remind myself I don't know everything about leadership, and it's just great to go to different events, network with people, watch people in leadership positions. So I think there are a lot of ways that you can begin and enhance your leadership skill and knowledge.
Oh, that's great. And I really appreciate the names of those books. They actually are in our book list, and hopefully some of these students will be selecting those books to read. They do have to select one book to read and write a report on. So that's great. I'm glad you reaffirmed those books. You just sold those books for people. They'll probably be on their top list. Those are great books. I really like those books. And thank you for your personal insights in that. And I think you illustrate a really good concept that we all are lifelong learners, regardless of what environment and role we play in our profession. So, and hopefully the students will pick up on that very well. So the last question I have is to make it contemporary, because I'm looking to see how history will play out in the future. So I have a question, and people say, why are you asking this? Well, I'm asking it because I'll be curious as I look at this interview in another few years and say, oh, wow, look what he said. Obviously, we're living in a strange time right now. Obviously, many people are working from home. Some of us are in our office, but it's isolated. There's no one here. We're teaching online. It's obviously something we've never witnessed in our lifetime, and hopefully we won't see this again. But how do you see this COVID-19 pandemic being an opportunity for the pharmacy profession? As I trace the history of our profession, key events in the world has really helped to transform how we responded and how we evolved. From things from the discovery of drugs and all the legislation and Medicare and Medicaid, how that was a spark to the development of health system pharmacy. How do you see maybe this pandemic being kind of another milestone in our profession, really an opportunity for us as a profession? So
Sure.
It's kind of words of prophecy. And we'll look back in a few years and we'll say, wow, he said that would be an opportunity. So go ahead.
Yeah, absolutely. And I don't think that I could say anything that people aren't already saying, and those who know more than I, coming forward. So many of us, we try to synthesize all the information we're getting to make sense of our world today and where it's headed. And so I put myself more in that category, not originating any of these thoughts, but really putting it together and helping our organization stay well grounded and focused on where we're going. But as a profession, clearly, the crisis that we're experiencing, and it's a health crisis, personal crisis, in many areas of the country. And at the same time, it is an opportunity for pharmacy and pharmacists. I thought from the very beginning, where all these stores were closed and businesses, but pharmacies remained open. And hearing that pharmacies were, their business was increasing, number of prescriptions, people coming into pharmacies, and you could already sense that people were looking to pharmacies for help with this in a lot of different ways. Now, with the obvious shortage of health professionals and primary care providers at a state level, certainly a lot of localities are looking to pharmacists to provide the kinds of services that are really needed. And so, again, it is a time of opportunity. It may play out a little bit differently in one state versus another. I know here they're immediately the State Board of Pharmacy and the governor issued emergency declarations that were expanding the functions that a pharmacist could perform, and then loosening up some of the regulations. Again, it allowed greater access to medications and roles of pharmacists. So I think that there is the opportunity that comes along with the crisis, and some of that opportunity will be long lasting in that roles that get changed, and we see that these are things that pharmacists can do, and the accessibility is there. If you look at COVID testing now that's expanding into pharmacies, hopefully when we have a vaccine for COVID, this will be focused. The availability will be focused in pharmacies, and it's certainly playing up in the public's mind and in our state governance what pharmacists can do. So I do think it is a turning point, and pharmacists, as much as possible, should step up to what is needed to be done. Sometimes that's in a chain pharmacy, it could be independent pharmacy, but it's also in our health systems, and other ways that pharmacists practice. So there's a lot of uncertainty, clearly, how long this is going to last, how long it's going to play out, what the effects on our economy will be. We have things that we can control and things that we can't control. So taking all that into account, what we know are some of the certainties, that there's a great need for what pharmacists do. And the things that are under our control, what we can do, that again, coming back to it, it is a great opportunity. I think pharmacists will step up. And I think in the years ahead, the way pharmacists are viewed will be different in that people will expect more from pharmacists.
Wow, thank you very much. That's definitely history in the making, and I really appreciate that. Well, thank you, Joe. This was wonderful. I really enjoyed this conversation with you and your insights, and this will be very much appreciated by our students. Thank you.